I'm Michael Kerman with Leading Edge Seminars, and I'm kind of particularly excited about this session with Lindsay Gibson. I'll tell you why in a second or in a minute. First, the format of our hour together will be I'll have a bunch of questions for Lindsay, many of which she's probably heard before lately. And then we'll open it up for questions from you in the last 20 minutes. And you can ask your questions by either putting them in the chat box, and Emily, who will be monitoring all this, will ask them, or you can come onto the screen and speak directly to Lindsay. So many of you know that Lindsay Gibson first published Adult Children of Emotionally Immature Parents in 2015. Though she's written 5 more books on this topic, it's really become a phenomena. And last Saturday, I opened my uh, digital version of the New York Times, and I always look forward to their long interview. It's called The Interview, it's weekly. And in the last few months, they've had Denzel Washington, Lady Gaga, Serena Williams, Ben Stiller. And then it said, today we're interviewing Dr. Lindsay C. Gibson. And I bet your life since Saturday has been it's been busy anyway, because the book has sold over 1 million copies, and and you're a phenomena actually. So I'm really thrilled. Also, if people watching don't know, you'll be leading a 3-hour webinar on this topic in June for us at Leading Edge Seminars. And I know many of you out there know very well about the difficulty in treating a population whose struggles started early in life after being felt uncared for, lonely, abandoned. And really appreciate that Lindsay has brought this out to the popular culture so more and more people are aware of these consequences. So Lindsay, welcome. Welcome from Virginia. I'm really glad you're here with us today.
Oh, I'm thrilled to be here. Thank you for having me.
Well, I'll tell you where I'd like to start, which I often like to start with. If you could share something of your background and influences and therapeutic approaches as you were starting out in your therapy and kind of leading up to your understanding of the importance of emotionally immature parents. Like, where are you coming from
Yeah,
early on?
yeah. Well, originally, in my starting with my master's training, I came from a very psychoanalytic and psychodynamic background. That's just the nature of my training. But the good thing about that is that the psychodynamic approach really stresses child development. And it stresses what you can expect at different ages for children in terms of their psychological development and also their sense of self and their emotional control. So I had a real thorough grounding in that. And I also did a lot of psychological evaluations. And one of the things that people want to know when they send a person in for psychological testing is they kind of want to know, where is this person functioning in terms of their psychological maturity level? They don't often put it that way, but they find it very helpful if I explain that, in terms of their emotional control or their foresight or their empathy for other people, that they're really functioning at the toddler level, or they're really functioning like, a 14-year-old. That's been a very helpful kind of shorthand to use in my psychological evaluations. So thorough grounding in child development. Then I guess it was probably, I don't know, it could have been like 15, 20 years ago, I really began listening to my psychotherapy patients with new ears, um, because they would come in and describe the behavior of the people in their lives. And I would be struck by why these were the people who had come in for therapy, because the people they were describing in their lives clearly were functioning at a much lower psychological level than my patient. And my patient had been willing to come in, get a psychiatric diagnosis, um, identify themselves as a patient in need of treatment, in order to get help for dealing with these other people who are running around doing whatever they want and blaming everybody else. So this stirred up a sort of a feeling of mission in me. There seemed to be a kind of, I don't know, maybe a kind of an injustice that these people who were internalizing so much, struggling to understand, trying so hard, these were the people that were coming in and being identified as having psychological problems. So when I began to share with people my impressions of some of the people they were in relationships with, that they sounded, emotionally immature, that they sounded like that 14-year-old or like that 4-year-old, that was extremely helpful to them because it was a non-pathologizing way of validating why they were having so much trouble, and also kind of indicated the direction for their interventions that might be more useful than appealing to that other person's often non-existent reasonableness. So I sort of shifted at that point when I realized how truly beneficial the psychoeducation was to my clients, to understand that this person was doing the best they could, just like a 4-year-old is doing the best they can, but you can't expect that they're going to be able to reciprocate the kind of relational maturity that you may want. So that's how it kind of came to evolve for me.
Well, in those initial interviews, what are some of the key questions or issues you focus on to assess um, their emotionally immature parents and the influence they have on them?
Yeah, well, when people first come in to see any of us as clinicians, they're usually going to focus on a symptom or an emotional state, or it could be a relationship, could be a work relationship, but whatever it is that they're focused on, after maybe 5 or 6 sessions, they will begin to start talking about problems in their daily life. They've relaxed enough, they feel safe enough, and they're feeling that they can confide in you. So sooner rather than later, they will bring up a problematic relationship, something that happened that day, or they'll just be in a depressed or sad mood, and our discussion will lead us to an incident with a person like this in their life. So what I was hearing about was behavior that was in their loved one, or it could be their boss, behavior that was very egocentric. If I had to pick one thing to describe emotional immaturity, it would be this foundational egocentrism that the person just never kind of grew out of. In other words, they didn't develop sufficient empathy for other people emotionally, and they didn't develop the capacity for mentalization. That is, developing a theory of mind that they could put themselves in someone else's shoes and imagine how a situation looked to them or how they might be thinking about something. So when I would reflect this to them and put it in those kinds of terms, they would kind of go, yes, yes, exactly. It's all about them. I try to tell them my problem and they tell me their problems. So that would be the sort of the cardinal sign that there was something like that going on. The other one would be that anything having to do with intimate emotional content or sharing would really not be possible with these people. A lot of my clients would complain that they would be trying to be understood by their partner or by their parent. And so they would open up and they would tell them how they were feeling or how what the other person did made them feel. And they would be rebuffed, or the other person might get angry, or the other person might dismiss what they said. Emotionally immature people are big on denial, dismissal, and oh gosh, what's the other one? Distortion. Yeah. So they couldn't get a sense of being heard. And that was very discouraging to them. Unfortunately, it only made them try harder. It's like intermittent reinforcement. Once in a while, an emotionally immature person will give you some empathy or listen to you just enough to keep you trying. But those are the things that would really stand out to me.
So you talk about their egocentric nature, but also you talk about their self-doubt and guilt as as things they struggle with in their daily life. So how do you help people navigate feelings of self-doubt and guilt?
Yeah, I just want to clarify that it would be the emotionally immature person who would be showing the egocentrism and the poor empathy. Yeah. The effect of the um, really profound levels of egocentrism in the emotionally immature person, the effect of that on their child, let's talk about, narrow it down to the adult children of these kinds of parents. The effect on those children is going to be that they are going to need that child to do two things for them psychologically, because these are like people whose batteries aren't included. Okay.
Hmm.
They need to hook up with another soul that has these ego strengths or these coping strengths that can kind of complete them and help them do two things. One is to maintain their emotional stability. So don't you do anything that's going to upset me, like disagree with me. And then the second thing would be make sure that you shore up my self-esteem, because since I don't have a very good sense of self, I need constant affirmation from you that I am the most important person to you, that there's nobody better than me, that kind of thing. So in order to accomplish those two things, the emotionally immature person will use what I call emotional coercion. That is a whole universe of behaviors and little facial expressions and little body languages that effectively move the other person into an unbalanced, self-doubting position. And when they do that, the adult child, and this is all through their childhood into their adulthood, they are made to feel shame, guilt, self-doubt, and many times outright fear. And the parent is able to maintain really effective control psychologically over the child by reacting to them in ways that encourage those kinds of feelings. Like for guilt, it would be if the child says to the parent, "Mom, you never listen to me. I'm trying to tell you my problem." "Oh, well, I must just be the worst mother ever. I can't do anything right. I try and I try, and it just makes me so sad that you kids just don't understand how hard it is for me." Okay, so the poor person is like, "Oh my gosh, I'm a terrible person. I feel awful and guilty because I burdened my mother with this." Um, Same thing with self-doubt. When you have someone who denies, dismisses, and distorts reality, I mean, for emotionally immature people, reality is an option. It's optional. It's not something that we try to discover and live by. It's whatever they feel like it is. So they will give feedback that they feel this reality was another way. Like, I never said that. I didn't mean that. Where did you get that from? If you weren't so busy doing such and such, you would have realized. And if you are at all self-reflective, which many of these adult children are, that come for therapy anyway, you will begin to self-doubt because you have the capacity for self-reflection. And When we self-reflect, we open up the opportunity for ourselves to change. But whoa, we really open the door to self-doubt. I mean, it's part of the process. You have to have a little bit of healthy self-doubt in order to self-reflect. But that gets really capitalized on and exploited when you're dealing with an emotionally immature person. And then, of course, shame is, how dare you talk to me that way? Who do you think you are? You should be ashamed of yourself for saying such a thing. Uh, and then fear is when you have been hit, when you have been humiliated, when you have been overpowered by that parent growing up. It doesn't take a whole lot, even in adulthood, to ring that bell of fear again in order to make you do what they want you to.
So in exploring their childhoods, they become even more aware of what happened to them and maybe why it happened, and how do you balance the validation of their experience with helping them take responsibility for their lives in the future, how they can make this change and start to lose that victim identity.
Yeah, it's interesting, Michael, but I love it that you brought this question up because it's a really good one. The thing about your client having a victim identity, and do they are they held back by that? Sometimes it's almost, to me, like a sign of progress when they make it to the point of having a victim identity. Because the victim identity thing is usually one of the primary maneuvers that emotionally immature people get into and use, where they always see themselves as the victim in that drama triangle. There's a villain, there's a victim, and there's a rescuer. And they're always painting themselves as, I'm at the mercy of this situation or these people that are hurting me, and I need you to come rescue me. On the other hand, the kind of people the kind of self-referring people that we would see in psychotherapy typically, those people tend to be more of the rescuer type, where they internalize the suffering as they see it of the emotionally immature person, and they go in where angels fear to tread. It's like no good deed goes unpunished. So they jump in to try to rescue this person who's deep in the victim mindset, and often get rebuffed for that or resented for that, because that emotionally immature person is actually quite invested in their victim identity. So when they begin to move from identifying or over-identifying with the emotionally immature person's problems, and they begin to think about its effect on them, there is, I think, a legitimate period of self-validation that something really did happen to you psychologically as a result of having parents who treated you this way. And we can understand that. We can understand that impact. And yes, in some ways, you are going to begin to realize how you have been made a victim or have been a victim of this kind of unfair or emotionally injurious behavior. Okay. So to me, that victim mentality is when the person has begun to realize what has been done to them and how. Now, from that standpoint, though, we can't rest there as therapists, because we want the person to make the all-important move from a kind of a passive, disempowered, often dissociated, but a kind of a helpless mindset where, oh, what can I do? If I confront mom, she's going to be upset with me. If I tell dad I disagree, he's going to blow a gasket. So they learn to get along by going along. And they often feel like they don't have agency or efficacy in their relationships because they're always putting that other person first. It's like they may not say it this way, but their behavior is predicated on the underlying agreement between them and the emotionally immature person, that emotionally immature person is the most important person in the relationship. Their needs trump everything. And the person goes along with that in a kind of a passive way because that's been their survival tactic. So part of what we're trying to do as therapists is we want to validate and acknowledge what happened to them. That means dealing with oftentimes the shock and the grief of having been victimized, okay, in these ways. And then we want to begin to question their adaptation to this, their tendency to be passive or to, kind of disengage from their own feelings as a defense mechanism. So when we start that process, we begin to look at what is so terrifying to them about, well, I started to say speaking their mind, but there are so many steps before they can even know their mind because they have really been, and I don't use this word lightly, brainwashed into believing that their perceptions and their needs, that there's something wrong with them. They're too needy, they're a bother, they want too much, they speak up too much, and they tend to pull back as a defense against that. So we're trying to explore what would be so bad morally about saying, I can't take that trip with you, Mom, or we can't do that this weekend, Dad. What would that make you feel to say no and really go into depth in what that experience is like? And that's what begins to release some of the underlying unconscious beliefs about the terms of the relationship.
I could see how valuable this kind of awareness would be in couples therapy and family therapy. Do you do either of those, or do you see how it's being integrated from what you've been offering?
Yeah, I could easily imagine how it could be well integrated. I think it's a sort of a way of understanding our levels of maturity and immaturity that could be worked with, within families and within couples. I personally stick with the individual therapy. The family therapy and the couples therapy for me always had so many moving parts that I was constantly feeling like I was playing catch up. And I think for some people, maybe more extroverted people than me, that's fun. For me, I always felt like I was a little behind the moment in those kind of situations. So I really preferred the more reflective and more depth-oriented individual therapy. But I think it's easily adjustable, and I would love to see more of group therapies using these concepts. I think that could be incredibly supportive to people.
Sounds like these would be very fruitful areas for research,
Mm-hmm.
for sure. Now, most therapists these days, from what I see, are very inclusive of different ideas. They integrate ideas from internal family systems, from somatic approaches. Do you see approaches that would best suit working in the style you work? You work differently as an individual therapist with a psychodynamic background, but what approaches do you see out there are the more readily available to use some of your findings and approach?
Yeah, Michael, I should have said I am a recovering psychoanalytic, psychodynamic person.
Okay.
Because when I started using internal family systems and Diana Foch's accelerated experiential dynamic psychotherapy and Bruce Ecker's coherence therapy, in my treatment, it was like the lights were going on all over the place. I have clients who have dated their turnarounds to remember when we started talking about the parts and doing the parts work, and and I would be like, I sure do, because when I learned that, it was the most elegant, helpful, kind, interesting way of drawing patients into their inner world in a way that was relatable and not so abstract. I mean, I love to sit down with a nice textbook on attachment theory from a psychodynamic perspective. That's my idea of fun, but it doesn't translate well to usefulness necessarily in the psychotherapy hour. So I consider myself a real translator of that. And I think Dick Schwartz and Diana Fosha and Bruce Ecker, these people that I admire so much, they are excellent translators of these, deep intrapsychic theories into something that people can use. So yeah, I would identify myself as definitely eclectic, definitely using my own methods, but drawing heavily from these very practical approaches that have come on, within the last 20 years.
Yeah, that makes so much sense. And it's nice these walls are breaking down. It used to be I'm a this, I'm a that. Now it's I'm always learning and integrating.
Yeah.
I wonder if you could share a case example, maybe a brief case example that illustrates some transformative moment, something that particularly moved you when you were working with a client, where you saw the lights kind of go on uh, in working through some of the issues working with them. Do you have a case example you'd like to share? Or is that not fair?
No, no, it's just that there's so many of them. And that first book, the adult children book, is full of them, because at that point, I had a very heavy caseload. So, it was, like very available to me. Let me just think for a second about. Oh well, I mean, this is an example of how our understanding, my patient's understanding, or my client, our understanding of emotional immaturity and of the pitfalls of trying to have a relationship with a partner who is like that, or a parent who is like that. In this case, the person had both parents and a mate who was very emotionally immature. And that person used to just absolutely uh, have meltdowns and be so distraught that she was being, sort of gaslighted, and she wasn't being validated. She couldn't get an emotional connection going. She was always being made to feel guilty, like she wasn't enough. She was never doing enough. She took everything to heart. And watching that person over the years go from someone who is, just feeling emotionally flattened by the behavior of these emotionally immature people in her life, watching her go into a state of self-possession and
Mm,
self-connection, to where she could stand and listen to the things that her husband was saying or that her mother was saying, and she's connecting with herself, not trying to make sense out of what they're telling her. I mean, beyond, basic communication, but she's not trying to fit herself into this reflection, this inaccurate reflection that they were giving her of herself. Instead, she was listening, and part of her mind was going, yep, there it is. There it is. He's doing that because this, she's doing that because she's scared. There, that's his distortion. That's not my distortion. I know what happened. I know what he said. And so when I say that she became self-possessed and self-connected, I meant that she became her own reference point in the therapy. And she began to trust what she was feeling. we have our feelings, our intuitions, our instincts, and emotionally immature people disconnect us, not deliberately, they're not malevolent, but they're so certain about their perceptions that they convince us that we must be the ones who are off base. And it's very hard to come back from that if you don't understand, from a psychoeducation standpoint, what they're doing and why. So when she got that, she was able to reconnect with herself and reference her own perceptions. I mean, basically her own view of reality, her own memories of reality. And she understood why he was doing, her husband, why he was doing the things he was doing when he did it. And she understood why her mother could not stand to have deeply close or significant conversations with her, the emotional intimacy that she'd wanted from her mother for so long, why her mother couldn't give her empathy, couldn't give her praise or congratulations. Now she understood that her mother just wasn't capable of doing that kind of emotional intimacy, or that her husband was so defensive, he had to jump in and take over every time there was any kind of threat to him. So the way that it came out, that I could see the progress that she had made, was she was telling me about an encounter she had with a person who worked for her. And it was a pretty big error that this person made. And it could have really cost my client a lot of business. And she told me about it in terms of how she had understood the immaturity of that person, why they'd made the mistake. She knew if she called them on it in a rough way, that it would get worse, and that this person would not only not hear what she had to say, but would not learn a better way. And she just played the situation out perfectly in terms of keeping calm, not getting emotionally engaged, showing the person what needed to be done, pointing them in the right direction, and never losing her cool.
Mm.
And she came into therapy after that. She was so thrilled. She was comparing, here's what I would have done in the past, here's what I did now. And I said, listening to you, it's like, that you just played this incredibly difficult piece on a violin that that prodigies have trouble with, but you did it. And she said, that's right, I really did. And we were both so happy for her, because she took this issue and landed it in a way that this person who'd made the mistake could go on to grow. She's still working for her. And she had self-command, even though she knew how serious the error was. She had self-command and she had empathy for this young person and was able to steer it. She became the pilot, of her own encounter. And that's what we want the person to be able to get to.
Well, it's a beautiful example of, going from understanding to real behavioral change,
Yeah.
right? That's the
Yeah.
point. You can
Yeah.
understand all you like, but if you go back to your husband and act the same way, or your parents, it just makes the situation worse. So that's a very, very nice example of that transition. I have one more question, and then we're going to open it up to the audience. And anyone is welcome to put a question or a comment in the chat box. And or if you'd like to come on the screen and speak directly to Lindsay, please note that in the chat box as well, and we'll get you on the screen, hopefully. So I have a question about your upcoming webinar with us in June. Is there anything that you're going to be covering that you haven't had so much of a chance to discuss much in your books or presentations, or things that have happened since your book for clinicians in 2024 last year? Do you think there's new stuff happening that you're going to be happy to be discussing in your June program?
Yeah, for me, there's always new stuff because, like, remember what I said about that big attachment theory textbook?
Yeah.
I just love that, reading that stuff. And I love integrating therapeutic models, and I get ideas about that all the time. So, when I'm doing a webinar like we're going to be doing, it's always the cutting edge of what I have read recently. And it doesn't have to be the textbook. I mean, look at the world. Look at what happens when emotional immaturity infiltrates people's lives. I mean, there's just so many rich seams of thought and research that keep coming up. So it's, even though the book came out just in December, I'm constantly finding new applications of it, new examples of it, just by reading the daily news practically. But I also want to stress that I have gone from emphasizing describing the emotionally immature person, which I felt really needed to be done in great detail, to how can we cope with them? Okay, what can we do to recover from growing up with parents like this? To getting to understand the need to move from passivity to activity, self self assertion. But I would say that the latest um, evolvement of what I've been focusing on really goes toward what is the deep psychological impact that emotionally immature parents have on their children in a very foundational way, both in that person's self narrative, like how they have caused that person to think of themselves and tell a story about themselves, and also how they have been impacted in terms of how they feel about um, self-confidence, self-knowledge, trusting themselves. What do they do when that voice starts up that says, oh, wow, you really blew that, you were never made to do this. There's no point in trying. I mean, all these things that have really come to them through not having adequate support and mirroring and all those necessary parenting support things, that we want to help them understand, oh, I know what this is. I may have had it happen. In other words, I may have had those thoughts, right?
Mhm.
That's so deep in me that it's almost like my default position. But now it disturbs me. Like if I think an unkind thought about myself or I start to beat myself up, now after some therapy, understanding through psychoeducation the nature of these parents and the nature of their effect on us, we will be emotionally disturbed by that. And when I'm making the point I'm trying to make on this is that it's not just like sort of the cognitive distortion, like catching the cognitive distortion. I'm catastrophizing. I'm doing this. I'm doing that. It's not so much the cognitive thing. It's that when you get integrated enough in your sense of self, doing this kind of therapy, and you say something bad about yourself to yourself, you will have an emotional reaction now. And to me, that is like the most beautiful sign of growth and reintegration, the proof of that there could possibly be, because it will hurt you to talk about or think about yourself in such unkind ways. That becomes a gut reaction.
Mm.
You may go through a period of where you catch yourself thinking things or writing things, and then it's like, no, I don't want to. I don't want to promote that about myself. I felt it. that to me is where real psychological change is occurring, because now we're down in the nice emotional centers of the brain, where our relationships are, where our sense of self originates. And this is powerful, deep stuff. And so when you get that feeling in your gut, like, that wasn't treating myself very well, or I feel bad about, joking and putting myself down, you are really moving in terms of your growth. So I think that it's important to realize that we're trying to get to the point where we're so self-connected and we trust ourselves, and we've tested this out. We aren't just, becoming, in our own little reality bubble. We've tested out that we are really able to tell when somebody is treating us badly or treating us with disrespect. And we're
Mhm.
able to respond to it in ways with boundaries, et cetera, that help us to get ourselves back on track, but also keeps us from tearing ourselves down. Because, lots of times, literally, that's what we've been encouraged to do in order to have the emotionally immature person maintain their sense of control and goodness.
Okay, we're going to open up for questions. Emily, I think there's been a lot of buzzing about on our
Oh
chat line.
my
So
goodness, has
do you
there
want to start?
ever? Of course. So our first question that includes a number of thumbs up and a lot of comments is there a way to distinguish between a parent who is emotionally immature and parents who believe from cultural standpoints that you don't challenge them, hold them responsible, or ask them to tend to your emotions, whereas if you do, it leads to shaming or threats to disown for challenging the hierarchy?
Yes, that's such a good question, because there are like embedded expectations that are often very culturally based, especially for the role of parents. Okay, that is a real hot button issue these days, because in many cultures, maybe it's in all cultures, I'm not sure, but there is this expectation that the parent is always right, and that the parent is entitled to the attention of their children. That, in other words, the child should revolve around the parent's needs. I'm talking about as an adult now. And lots of times it's like a person thinks, well, how can my parent be emotionally immature when every other parent in my culture, my friends' parents, they're all exactly the same? I mean, the assumption is that honoring your parent is the primary good model. And so it's not that the person is immature, they would say. It's that they're just following the culture. And what I would say to that, and this is a hard distinction, but yes, let's just go with the thing that it's all cultural. Let's pretend that for a moment. So if it's all cultural, and there's certain things that are expected of you and whatever, there are still parents who are more emotionally mature, in the sense that they have more empathy for their children. They can tolerate emotional intimacy with their children. They can listen, they can share. They may still have many of the knee-jerk reactions, okay, of their culture as a parent, and they may enact that or even enforce that. But when they see, or when they, I should really say, when they feel their child's distress over that, or they get that twinge, like they are taking something vital out of their child by being so rigid or whatever, that emotional maturity in that parent, that openness to their child, that can happen and does happen within any culture, okay, where it goes to the level of person to person, heart to heart. That parent is there for that child at an emotional level. When the child really needs them emotionally, that parent is there because they're emotionally mature enough to entertain empathy and a realistic understanding of the other person's psychological reality. Now, maybe in their daily life, or maybe when they get defensive, or maybe when push comes to shove, yeah, maybe they jump back into their culturally defined roles and have expectations. But if they are sufficiently emotionally mature, and if it is really crucial for that adult child to individuate and go on with their life, or to, have themselves be understood as different from that parent, that more emotionally mature person, even embedded in that culture, will usually be able to find some way forward in a respectful relationship with that child's individuality. Okay. So, emotional immaturity is a continuum in my mind. There's nobody who's completely emotionally immature, and there's nobody who's completely emotionally mature. I always qualify when I say emotionally mature. I always say adequately emotionally mature, sufficiently emotionally mature. I even got at the thesaurus once on looking up, synonyms for sufficiently, satisfactorily, because, if any of us get sick, or we're tired, or we're stressed, all of us slide down into more emotionally immature behavior. Okay. That's not the mark of being emotionally mature, that you never have a bad day, or that you're never selfish, or that you're never disrespectful. That's not the qualification. It's, are you able, when you kind of get yourself back together, are you able at some point to reflect on your behavior and imagine the experience and feel the experience of the other person to a degree that it changes your response to them? Are you able to get there? And that's where the difference really lies. There is not the kind of malignant egocentrism and lack of, or I should say, poor empathy, and the lack of self-reflection. That is not there in the sufficiently emotionally mature person. They have matured past that, and now they couldn't go back to being non-empathic and completely self-absorbed if they wanted to. I mean, once you get a conscience, or once you get empathy, you don't lose that. That has now become integrated into a more complex form of personality that will be there no matter what happens. So yes, culture, there are cultures that are probably more or less rigid in terms of behaviors that could be considered emotionally immature. But there will be individual characteristics in the parents that's going to show a difference in where they kind of end up operating out of on this continuum.
Thank you. Our next question is about the emotionally immature parent. Can a parent break out of being emotionally immature? And can that parent learn self-reflection?
I just had like three thoughts at once. I'm just thinking of that old word that we might still use it, but we used to use it a lot for prisons. We called them penitentiaries. What that meant originally was that the person went there to become penitent, meaning the penitent person sort of reflected on their quote unquote sins, and they came to regret them, and they came to feel that they wanted to make amends for them. That's what being penitent is. That was sort of the process of course, back in the centuries before, we didn't say to ourselves, let's curb their acting out to the point where they have to self-reflect. We didn't put it in those terms. We just locked people up, hoping that they would have a moral aha and change their ways. But it's it's that idea that if the person can't act out in a way that blows off responsibility and emotional accountability to other people, if they're blocked on that, and this could occur because, maybe they've alienated all their children, or maybe they're about to lose their job, or maybe they got in trouble with the courts, or maybe their spouse is about to leave them. There can be change in their life, usually as a result of something that they've done. They can then have a sort of like a waking up experience a little bit, that maybe I had something to do with this, and maybe I need to be aware, or maybe I need to change something. But this often happens in very, very small, intermittent intervals. So it's a question of, can they change? Yes. Anybody who wants to change has, by definition, entered into a state of self-reflection. How else would they know? But when they are self-reflecting, is it something that they can do long enough to really apply and begin to change their behavior? And oftentimes, sort of the best that you get with an emotionally mature person is that when they're calm, when they're not feeling defensive, when they're feeling well-resourced, they can present themselves, stretch themselves to appear more receptive and more emotionally mature than they're able to maintain at a daily level. They're like Gumby, that stretchy toy. They can stretch themselves when they're feeling good, or if there's something they really want. Okay, they're motivated to change, but that pull is always coming back to the original emotionally immature configuration, because they really haven't gone through the self-reflective growth process. So yes, they can change, but will the change stick? And also, has it come about because of self-reflection, or are they only responding to a momentary cost that has driven them into therapy or into trying to change?
Thank you. We'd like to know your thoughts on going no contact with an emotionally immature parent who refuses or is unable to change their behavior.
Yeah, this is a big item lately. The issue of estrangement has been hugely hurtful to a lot of parents who have no idea, it appears, why their children don't want to have contact with them. And what that tells me is that to me, it's a very sad situation, because who wouldn't feel devastated by having an adult child who went no contact? Because first of all, if you are fairly emotionally immature, probably not great in having empathy or mentalization of other people's viewpoints, then it's not going to make sense to you what they're telling you about why they want to have less contact, or why they want you to treat them a certain way, or why it's important that you not use this tone or say these words. That won't make sense to them, because for the emotionally more immature person, everything is about their intention, not their impact. So if they say, well, I didn't mean to, or I'm sorry it made you feel that way, what they're really saying is, my reality is based on my intention. So if I didn't intend it, how could it possibly have hurt you? It's like, you and I are the same, because I don't really emotionally recognize your individuation from me. So, ipso facto, how can it be that I have done anything that would drive you away from me when I love you so much. And see, this to me is a tragedy, because if that parent, gosh, if that parent could listen or could say, honey, what do you mean? Tell me what I did. I'm so sorry. I want to learn. Tell me what it was that I did and why it affected you this way. You would not have people going no contact. A lot of times, people who are the sort of the recipient of the cutoff, let's say it's the emotionally immature parent, and their child has estranged themselves or gone no contact. Oftentimes when that happens, the parent comes back with a kind of an analysis, a kind of a self-analysis. And they say, gee, okay, am I a really bad person? Because, immaturity means you see everything in rigid black and white categories. So if my child says, Dad, don't talk to me like that in that tone, or I'm going to have to leave, the father hears, you're a terrible person. So the question the parent asks themselves in reflecting, quote unquote, on this is, am I a terrible person? Not, does my son deserve respect? And when the parent reflects on, am I a terrible person? They say, well, I put a roof over their head. I paid for their college. They had food on the table. I worked 2 jobs. And they come to the conclusion, I was a good parent. There's no reason for them to be upset with me. And they proceed from there. But yes, all of that is true. And yes, I'm sure that any of us who have made it to adulthood are grateful for what was done for us. But the problem is that the problem is that the issues are still ongoing. If the parent did something in childhood, and the parent made a mistake, that's one thing. That might be, I mean, lots of times the way the parent who has been estranged will frame it is, oh yeah, they're crying because what I didn't give them the right gift at Christmas, is like, I mean, they're very derogatory about the reasons for it, and it becomes a thing where you want to say to them, it's not about what you didn't get them for Christmas that year. This stuff is still going on. Your response to their attempt to communicate to you about their feelings happened last week. This is not about what happened when I was 7. This is about the way that you continue to treat me or not listen to me or, put me down or whatever it is. That's happening right now. That's why I don't want to have contact. But that is so horribly painful for any parent. I don't care if you're emotionally mature or mature. It is so horribly painful that I think they can hardly think about it. And they come back with these involuntary defenses. They're not plotting and planning to be, stubborn or to make their children feel like they have to cut off contact. They're not trying to do that. It's just that their automatic self-protectiveness kicks in, and they really can't do anything with it except to blame the child and or the therapist. Okay, because lots of times you have to remember that emotionally immature people externalize. It's never them. It's always somebody else. And so a lot of times the parent who has been estranged paints the picture of the child being brainwashed, by the money-hungry therapist or cult leader therapist who's trying to separate parents from their children. This is quite a popular story. And the parent, again, to go back to what Michael was saying earlier, the parent becomes the victim. And now the hard-hearted adult child is keeping them from their loving contact. But if only they could listen, but they really can't, because their sense of self and their psychological vulnerability is like that of the young child. And young children cannot tolerate or integrate information that hurts their feelings or makes them feel bad about themselves. They just can't do it. It's like asking them to hold their hand on a hot stove. There will be a reaction against doing that. And that's what often happens when there's a no contact situation. I wanted to mention, just to make sure this is understood, that I am of the mind of Murray Bowen, who talked about the emotional cutoff in family systems therapy, that when a person seeks individuation or differentiation from their family of origin by moving 3,000 miles across the country, that's not going to work. They're going to carry their family system's mindset and their lack of individuation with them, and they will reenact it, in, wherever, 3,000 miles away. Cutting off contact is not a solution to your growth problem or your growth issue. If you want to individuate and become yourself, I often encourage people to look at it that way, that these struggles with the emotionally immature parent are going to help them get stronger in finding their own identity and feeling, more self-accepting on the inside. So if you can stick it out, I think maintaining the relationship with the parent gives you more opportunity to practice that. So I'm not a person who jumps to estrangement right away at all. The only time I even bring up the question, do you want to keep having this much contact with your parent? The only time I bring that up is if I can see that the person is emotionally or physically being harmed by the relationship, in my view. And that's when I'm going to introduce it, even if they're not, because sometimes it appears that hasn't even occurred to them as an option, that they could cut back on the amount of contact, or they could do what I call take a break, just suspend contact for a while. I'm not a proponent of, like you're doing well and succeeding in therapy if you cut the person off in your life, because they're still inside you. You're still dealing with the dynamics, but in rare cases where the parent is not receptive, the person has been very badly hurt and continues to be hurt, then I think that we have an obligation to support that client's decision to go no contact, that we validate the reasons for that and their feelings for that. We might keep in mind that that could change, but I think it's important for us to, always, we want to validate the person's feelings, but we also don't want to step in and, sort of make a decision for the client that estrangement or no contact is the answer. But we do want to discuss it with them so they can make that decision if it's in the best interest of their health. That's a very long answer. I'm sorry, but it's an important one.
Absolutely. Thank you so much.
Lindsay, I really appreciate your thoughtful answers to the questions of our viewers and from me, and I'm really looking forward to your June webinar with us. I apologize to all those people who have a lot more questions, but Lindsay allotted an hour of her very special time these days to be with us, and I really appreciate it. And I appreciate everyone for watching and for asking those questions. And I hope everyone has a great day wherever you are. Thanks again for being here.
Yes, thank you guys. It's been wonderful being with you.